we have the same amount of seniors that are in that program, and yet it grew by 7 or 8%. This year, we have found or put an investment of another $11 million into this program. I think total program cost right now on that one is about $181 million. It is based from that decision as well, was based on sharing the cost of this program at 75-25. Okay, that 75% government will pick up, 25% the seniors will pick up. This originally was, I think, a 50-50 program. If you look back at the history of this program, where it was going, but of course, government has been able to pick up a huge amount of the costs of this program, and I think we will continue to pick up the larger part of the increase in this program. If you look at who receives payments or who receives the pharmacare, there's approximately 42,000 seniors who pay full premium. So, of course, they're paying somewhere of $900 and change for this program to receive, a non-capped amount of pharmaceuticals. Approximately 6,000 seniors pay a partial premium, and approximately 48,000 seniors pay no premium. So they're paying, of course, just the copay. And of this number, 40,000 receive GIS, 4,200 are low income, 3,000 are in nursing homes. So there is a huge number, over 50% of seniors in this province that receive pharmacare who do not pay a premium on this one. So I would say, compared to other programs in Atlantic Canada, to other programs in Canada, seniors in Nova Scotia are paying far less than their counterparts in other provinces. And Mr. Chair, we will continue in the department to invest in this program. But the other things that we need to do as well is look at the load that seniors are bringing forward. These are the prescriptions that they have. A lot of times they come from different practitioners. A lot of times they're being filled by different pharmacies. And what we need to continue to do is looking at the effectiveness, and we're started a pilot project, I believe, in Truro, to look at what kind of prescriptions are being brought in, going back to their physicians, and coming up with more effective treatments for the ailments that they bring forward to us. So, Mr. Chair, in most cases, we do see a savings to the senior on reduced lists, and in some cases, we see better results because they're getting actually the drugs that they require. So Mr. Chair, I know that no increase is good, but I'm suggesting that we need to have a program that will be here into the future for all seniors. We will continue to invest these large sums of money. $11 million, in my mind, is nothing to sneeze at. And Mr. Chair, we will continue to make it effective well into the future.
Thank you. The Honourable, the Leader of the Official Opposition.
Thank you, Mr. Chairman. I'm just not going to let the minister get away with this. I mean, he poses the philosophical question, the ethical question of how long should a life-saving drug be funded, and what should be the efficiency of that drug in terms of saving somebody's lives. And he poses the question, should it be 2 weeks? Should it be 2 months? Should it be 4.7 months, I think he said, with respect to Avastin? How long does it have to be? And he poses that as an ethical consideration. Well, Mr. Chairman, if it was your life, how long would it have to be? How long would it have to be before it would be important? Mr. Chairman, every single life hangs by a thread, but it is a precious thread. And I do not accept the minister trying to justify this kind of decision by simply putting it in the context of what length of time it is that a person's life can be extended. That is not the job of the Department of Health. The job of the Department of Health is to fund effective therapies, to fund prescribed medication, and leave it to the physicians to decide whether or not a person can benefit from the medication. That's who should be deciding, and that's not what's happening. Mr. Chairman, in this province. And I think it's a terrible injustice that we are doing to many people who could benefit from drugs such as Avastin. I raised the question of the seniors pharmacare program, and again, as you know, and I understand the arguments around the whole question of how much money the government is putting into the program. You know, and there's no question that the costs of drugs continue to climb every year. However, what I'm suggesting to the minister is he look at the efficacy of the increases that he is charging with respect to the result on the rest of the system. And I pointed out to him what the 4 major problems with the increases in the cost of medication are when it comes to the senior population. And I posed to him the question of whether or not it is an ineffective strategy to try and claw back a modest amount of money out of the pockets of seniors and have as a result the fact that you send them into the hospital more frequently, you send them to the doctors more frequently, and you send them into hospitals for longer periods of time, and some of them don't even get that option, Mr. Speaker, Mr. Chairman, because of the increase in mortality. That is the question that's being posed to the minister. Isn't this just an ineffective strategy?
You know, to the member opposite, you know, what I really feel is that there has to be some kind of predictability in a system. And I think the predictability that we have provided with the Seniors Pharmacare program and sharing those costs, 25/75, lets seniors make a decision and be able to plan once a year on where those costs will be. Mr. Chair, if I would have felt that seniors would not be able to pay for this program, I think the outcome would be different. But I think by knowing what the cost will be up front, knowing who will be able to pay for it, who is exempted from it, I think at the end of the day that seniors appreciate having the Nova Scotia Seniors Pharmacare program. If you look at another comment that the Leader of the Opposition made, is that he talks about clinicians making complete decisions on the kind of drugs and effectivenesses or efficiencies, efficacies that certain drugs will give. But Mr. Chair, if we approved every single drug that came to our department, I would suggest that we would have no monies to do anything else. As laudable as that may seem, as important as it may seem, there are things that we can do and there are things we cannot do. And Mr. Chair, I will leave it again to the experts of our Cancer Therapy Committee to make a decision on the effectiveness and the appropriateness of cancer therapies. I am not a clinician, and I will not make a decision for that group. That group will, again, like I said, they have not made it's never a final decision. We will continue to provide information to them. They will continue to review that, and maybe the answer will be different next time. But again, with the issue is that if we funded everything, again, we would not have enough funding for the other programs that are very important to us, which is, of course, the hospital system, our seniors continuing care system, and all those other things. So we do have competing priorities, and again, we have to find that balance.
The Honourable Leader of the Official Opposition.
Well, Mr. Chairman, here is the irony of what the Minister of Health is saying. Because what he is saying is exactly what he will not do. Twice Avastin has been recommended by the very committee that he cites. And instead of taking that advice, they have referred it back to the committee. So my very simple question to the Minister is, why won't you take the advice of that committee?
The Minister of Health.
Again, when the first decision had been rendered, not all the information we felt, the Deputy Minister at the time felt, had been considered. We did not have a full complement of members on that committee. there were a number of different decisions that happened across the country that we wanted some further information on. And that's why the decision was sent to at that time. There was only one positive decision at that time. We was then further reviewed, and then the negative decision came forward. But again, at that time, when it was first decided, there was not the ethical framework that we had put in place. There were some other operational pieces that were not in place in that committee. But right now, the committee has decided that we should not fund that drug, and I will stand with the committee's decision.
Thank you. The Honourable, the Leader of the Official Opposition.
So let me get this right. You will accept the recommendation that you like, and you won't accept the recommendation you don't like. I mean, that is what you've said, Mr. Minister. There was a recommendation, and so you'll take the recommendation of the committee. If you feel the makeup of the committee is appropriate, you'll take the recommendation. I mean, you'll go back and actually look at the makeup of the committee to try and decide whether or not, if in your view, you ought to take the recommendation. Well, you know, I'm not going to beat this one any further. I think, you know, the point is made, Mr. Chairman. This, I believe, is a poor decision made by the Department of Health. It's a poor decision that the minister agrees with, and I would, you know, all I can do is try to prevail on him to change his point of view with respect to this particular drug. I want to move on because I talked a little bit about the results of the decision made by the Department of Health with respect to pharmacare, and what I believe is an ineffective response by the department with respect to the increase in pharmacare fees. But it underlines a very interesting question with respect to the next piece of the pharmacare puzzle, because the policy of the government with respect to pharmacare, and this came about as a result of the election platform of 2006, was to institute what they have called a Working Families Pharmacare Program. Now, just so that we can start this one out, let's be clear that the Working Families Pharmacare Program will benefit not a single solitary individual in this province in this year, because the money's not there. The idea, as the minister said, for this was to set up technical and administrative structure so that the program can be implemented in a further year. Okay. I heard the Premier the other day in a scrum say, well, we meant to bring this in on the 1st of January, so we're putting it off 3 months. And then he said March 1st, but I assume he meant March 31st. In that area, to some degree. So the real question here is, now we have a system, a seniors pharmacare program that has a couple of interesting facets to it. Of course, it has a premium and it has a copay. So if you're going to set up an insurance program for pharmaceuticals, the first thing you have to know is what is the premium that you're going to charge to people, and what is the copay that's going to be expected of them with respect to the drawdown of those drugs. Because that, Mr. Chairman, is what determines the uptake on the program. So, very simple question. Will the Working Families Pharmacare Program reflect the same levels of premium and copays as the Seniors Pharmacare Program reflects today?
Thank you. The Honourable, the Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, I'd like to change the name to the Working Families to maybe a Nova Scotia Pharmacare Program, because I think it will benefit way more than just families in this province. There's a lot of single family units and those kinds of things that we do want to extend it to. But Mr. Chair, you know, the start date seems to be a little bit of a bun fight, and what I really want to say is that it again takes a bit of time and computer systems and infrastructure to start offering a program. It is our estimation at this point that we would have the program up and running by March, so that Nova Scotians will be receiving the benefits from that in this calendar year. The lead time required, and I know the department and of course our pharmacare division has pleaded with us to try to give them the time to do it correct. and we have given them the, we believe is a respective amount of time to set up this program. It is our mind that we have to balance this program with two competing programs. One of them, of course, being private insurance, medical insurance, so that people won't be jumping, or companies will not be jumping out of their programs and letting people jump into the government's program. Nor do we want the sort of a competition between what would be the Nova Scotia Farmer Care program and the Seniors Farmer Care program. We want them to be, we don't want it to be a better program, let's say, than the seniors program, and have seniors leave that program to try to be in another one. So it's trying to find that balance of what it's going to be. So, Mr. Chair, what I can say at this point, and the final design has not been decided on what our Farmer Care program is going to look like, but it will be very similar to the seniors one, where it will involve co-payments, premiums, and there's a balance between what that's going to be, but it would have to be very similar in costs.
Thank you. The Honourable, the Leader of the Official Opposition.
Well, thank you, Mr. Chairman. It's an interesting, the Minister, I guess, speculates a little bit about what that's going to have to look like. And just for the record, the Working Families Pharmacare moniker, and that was the name that was put on it by the minister's party during the last provincial election. It wasn't I didn't make that up. And so they're now getting into a discussion of what is a family, and do single individuals qualify under the program, and I understand that. But at one of the things they did over the course of that campaign was they costed the campaign, and I remember that the initial cost in the first year was supposed to be $25 million. So I'm going to ask the obvious question. Does the minister still believe that the first year of operation of the Pharmacare program will be $25 million?
The Honourable, the Minister of Health.
Thank you very much, Mr. Chair, and to the member opposite, as we've looked at a number of different configurations of what the Pharmacare program would look like. Of course, there's $5 million in this year to get the work done so that we can have that program start in the first quarter of 2008. If we look at what the costs are going to be, I believe it'll be quite a few $1 million more than that $25 million. I've seen estimates that range anywhere between 30, 36 to somewhere in the 40s, depending on that take-up. But of course, you're doing economic modeling, depending on what the numbers are going to look like, to how many people are going to subscribe to it, and those kinds of things. But at this point, our modeling and the work that we've done, and different reiterations we've looked at this point, it is in probably the $30 to $36 million range.
The Leader of the Official Opposition.
First year.
I don't know if his light was still on when he said that, but he said in his first year. He said in his first year because I believe I remember looking at the projections that were provided by the Conservative Party over the course of their campaign. They said $25 million in the first year, and I believe it was up to $75 million in the second year of the program. So that depends a lot. The way it was set out initially was that looked like really a third of a year. The $25 million looked like a third of a year program, because it was going to start on the 1st of January, so therefore it would have to be included in, for example, in this year's budget would cost $25 million, and a complete year program would cost something substantially more than that. So, I made this point before, Mr. Chairman, but I'm going to make it again. The way that this is being rolled out by the Minister of Health is in such a fashion that the hill keeps getting steeper the further you go into the program. So I realize that doesn't have to do with the appropriations or the estimates for this year, but I can tell the minister we're certainly going to look forward to trying to understand what that program is going to mean in the year to come, and as the minister points out, therefore, what other kinds of choices are going to have to be made. The minister himself points out that one of the results of trying to make these kinds of choices means that they have made a decision to cap this year's spending in the Department of Health. I think he said at 5%. I thought I was to understand it was 5.6%, but perhaps he's now saying 5-ish, a precise accounting term, I believe, Mr. Chairman. But here's the problem with all of that. I mean, if it is the case that health spending has increased by 8% a year, and you must remember that the fastest growing sectors within the health care budget, and again, I would invite the minister to correct me if I'm wrong, but the fastest growing areas within those budgets fall into two categories. They fall into the pharmacological envelope, the cost of drugs within the system, which continues to escalate at high rates, in fact, well above the 8% rate, and the cost of technology, because there is always new technology coming online, and there's always demands from the system to bring more of that technology into the system. So what happens, and I would point out, and the Minister of Health knows this, but I don't know that everybody else does, that those, in fact, are the two pieces of the public health care system that are private. These are the ones we don't have any control over. We are buying this technology. We are in many respects hostage to the drug companies. We have to pay for these drugs if we want them. So we don't have control from a public perspective over those aspects of the healthcare system. The other pieces of the healthcare system are in fact not growing at the same rates. So you can't depress any further your staffing rates or the other pieces of the envelope, even though they're some of the biggest pieces of the envelope. It's very difficult to compress those, and here's why. You can't depress those because that would mean the result of keeping those down are more emergency room closures, are longer wait lists. Mr. Chairman, those are the kinds of results you get if you try to enforce a smaller spending envelope on those areas of the system. So I wonder if the minister can tell us if they have looked at what areas of the healthcare spending they are going to try to contain. Where are the pressures going to come in order to be able to cap the healthcare spending at 5%?
Thank you very much, Mr. Chair. Mr. Chair, talking to my CFO here, is that we are at 5% this year. 5.6, I'm not too sure where that number would have came from, but anyway, it looks at about $140 million extra for the Department of Health to work on those issues that, of course, are growing year over year, as well as the new programs that we are talking about. But, Mr. Chair, the largest growing component of our healthcare budget, of course, is wages and wage settlements. 3/4 of that budget, of course, are wage-based. They of course pay for the human resources to run our department. And I think the issue for me of trying to bring that cap down is to have other dollars available in government to invest in departments like HPP, Health Promotion and Protection, in order to build infrastructure in communities, to look at healthy living, healthy eating programs that at the end of the day stop people from coming to the acute care system. That's where we need to start to push back and say some of these investments need to happen in other places in government that will, by effect, make our population healthier and bring the budget of the Department of Health down a little bit because we're not going to be treating them as frequently. Mr. Chair, I look back, I'm just trying to figure out what my numbers are here. I wrote down a note and I don't know what it was. 280,000, what was this number? That one. I think I had already answered that one.
Yeah, that's on the families.
Oh, okay, yeah, that was on just to go back, I think, in the start of that, you started with the pharmacare program and just sort of finished that thought and then moved into the issue of the broader piece, is that in the development of the program, if we look at about 142,000 Nova Scotians would be eligible to receive the pharmacare program. The modeling shows from experiences in Manitoba and other jurisdictions that it takes somewhere between 3 and 5 years to be fully subscribed. But depending on the model, we're still just looking at about 89,000 or 90,000 people would actually take on the program, which feel the need for further pharmacare coverage. So we're trying to work with those kinds of numbers. In a full year, should we estimate that amount of people take it on, we're looking at a program that would sort of be in the $75 to $80 million range per year. But anyway, back to the piece. I think it's important to look at the efficiencies in our system, to sharpen our pencils, because I know that the professionals within, the people that provide us with information, the people that work with our finances on a day-to-day basis, feel that some of these efficiencies and most of these efficiencies can be found. And Mr. Chair, I think the $140 million increase is a sizable increase for any department of government.
Thank you. The honourable member has approximately 9 minutes left in its time. The honourable member.
Well, thank you very much, Mr. Chairman. I appreciate what the minister is saying, but I pointed out to him that we have hundreds of days every year when emergency rooms around the province are closed. We still have long wait lists with respect to a number of procedures, a lot of those being orthopedic, Mr. Chairman. We have, in this province, people being treated in hallways. We have people in some hospitals who find themselves in patient lounges because they do not have beds. We have seniors who are in beds in hospital who need to be in long-term care facilities, and because of the lack of beds in long-term care facilities, are often sent far away from their family and friends, and the minister knows I've been talking about with him and with others about the whole 100-kilometer rule. As you can see, Mr. Chairman, there's a very logical connection between all of these things, and the minister knows it, and staff knows that that is the case. But what I want to know from the minister at this point is, given what he has said about the cap on healthcare spending this year, I just want to know how, in the context of the cap, is he going to be able to reduce the number of days emergency rooms are closed? How is he going to reduce the wait lists in all of the areas in which there are now long wait lists? How is he going to put an end to the hallway medicine that we see happening around the province?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, a number of issues come across there, and if you look through the budget documents, there has been some fair investment when it comes to long-term care. If you look at the mitigation strategies that we're putting forward with the district health authorities, show an added investment of about $10 million to address alternate level of care and trying to make people more comfortable as they wait for their placements in the long-term care facilities. We're looking at, he brought up the issue of emergency room closures. We're investing a couple $1 million on that side to make sure that we can either find the physicians or find strategies to keep those ERs open. But Mr. Chair, we talk about that particular issue, across the province in our ERs, we're open 98.5% of the time. That's a number dating back to May of 2006. So we do have some hot spots that we need to address, and we have put some funding in place. I think, Mr. Chair, what we've really tried to do in this year's budget is sort of do exactly opposite of what the member opposite suggests. I mean, the member opposite is suggesting to continue to throw money at things. And what we're trying to do is to be focused, to find the places where we do need to put investments to try to bring down these wait lists, to try to have better access within our hospitals, to stop some of the things that are happening. But Mr. Chair, I can say that you know, there is a fair amount of money put in place to do just the very things that the member opposite is bringing forward today.
Thank you. The Honourable, the Leader of the Official Opposition.
Thank you very much, Mr. Chairman. You know, we've all watched while the minister makes, I think, an attempt to try and say that these particular items are being dealt with. But the reality from the long-term care perspective is that the funding that exists in long-term care this year are funding the initiatives that are already underway from previous years. So the planned expansions of existing nursing homes and previously announced spending for projects that are underway are in this budget. But will the minister tell me or confirm that there is no funding in this budget for new initiatives or new building for this year in long-term care?
Thank you. The Honourable, the Minister of Health.
Thank you very much, Mr. Chair. And you know, if we look at, if we go back to the speech that I presented, and I should actually grab that quickly, and if I could find my spot in it, where we talked about the extra funding in long-term care. We're spending $342 million this year, I believe, on long-term care. Does that include home care as well, or is that just long-term care? We're looking at a $15 million increase in long-term care spending. Again, if we talk about that, we will spend $11.1 million this year to develop and implement the new initiatives as part of the second year of the continuing care strategy. If I go back to what the member opposite had a press conference, I think sometimes last week, and talked about the things that they feel that we should be doing to try to lessen the impact upon seniors. And I can say that, you know, looking quite extensively, of course, at their lists, you know, and I look at the things that we are doing, and I can say, you know, I had to put a check mark almost on everything that they brought forward of the things that we are doing or are already in progress. You know, let's just talk about some of the expansion things that we're doing in this year's budget over last year to continue to meet the expectations and meet what we've been laying forward in the continuing care strategy. Is that we're putting an additional $2.3 million to expand palliative care programs. We're investing $2 million to develop a caregiver strategy, which will, of course, help family members keep families in their homes. Another $3 million to improve respite options in both home care and long-term care. We'll invest $4 million in repairs and renovation to support seniors and people with disabilities living in their own homes. So all I can say, Mr. Chair, is that their crystal ball must be working well, or they've been actually reading our documentation to know the things that this department has taken seriously and will be implementing and continue to implement over the life of the continuing care strategy.
Thank you. The honourable member has approximately 1 minute and a half. The Honourable Leader of the Official Opposition.
Yeah, which is a shame, because I would like to pursue this, but there's one thing further that I want to ask the minister before he moves on to from my questioning to my colleagues in the Liberal caucus. I wonder if he could just refresh our memories as to which of the healthcare professionals in the system received more than a 5% increase last year in wages.
Thank you. The Honourable, the Minister of Health.
It'd be hard to dig apart, especially out of some of the wage settlements. Of course, there were some professionals that would have received different amounts. There's been an average of 2.9%, you know, which is, I think, what the member opposite is alluding to. But I think through some of the AFPs that we've been putting forward with a lot of specialists here in Capital, different specialty groups, that they have been receiving 5% in some cases. You know, at last I checked, a specialist and physicians and clinicians are frontline healthcare workers. You know, we will continue to invest and make sure that we adequately fund healthcare workers in this province, as we have done. Again, 3/4 of our $2.9 billion budget goes towards healthcare delivery and the people that so gratefully do that for us. And we'll continue to make sure that they receive the funding that is required. But Mr. Chair, we will also make sure that we can balance it against the other competing priorities in healthcare. You know, we're looking at 25% of that budget now that does all the other things that the member opposite has brought up during his questioning during this hour.
Thank you. The honourable member's time has expired. The Chair will now recognize the honourable member for Glace Bay.
Thank you, Mr. Chair. I think we have a tendency when we get into estimates to try and rush into things and ask everything all of a sudden because you want to jam everything into one big question period because the minister, well, hopefully will have a lot of the answers to the questions, but maybe perhaps the leader of the official opposition said he didn't get that feeling in the last hour or so, but he did stick to a subject anyway. I will say that, Mr. Speaker. Mr. Chair, I wanted to welcome the minister's staff to estimates, and I know that probably if there are positions in this province that you don't want, one would be the Minister of Health, and those would be the other two right there in the province. But I know, and I know how hard the staff works in the Department of Health, and I know that perhaps they don't hear it enough, but certainly the people of Nova Scotia and ourselves as legislators appreciate that work, and we know what you're dealing with. It is a never-ending challenge that you are dealing with in this field, and I think we all understand that. The Deputy Minister in particular, I think, is probably one of the hardest working Deputy Ministers in this government, Mr. Speaker. So, having said that, I may have cost her job, I'm not sure, but hopefully not. The Minister would realize that anyway. Mr. Chair, let me, there are, as I said, in the hours to come, a lot of things that we'll be discussing. But one of the things I wanted to bring to the Minister's attention from the start is a subject that we dealt with back in November of last year. And it was a matter that was raised to the Minister during question period, and it concerned Mr. Ed MacDonald of Cape Breton, who is currently in Toronto awaiting a lung transplant. And as I'm sure the Minister will recall, that the problem area was an anti-infection drug that Mr. MacDonald would require after his surgery. And that anti-infection drug would be in the vicinity of, I believe, $3,000 a month and would be required for a 3-month period. Now, at that particular time after question period, and the Minister did say that, of course, brought up the issue of catastrophic drug and catastrophic drug coverage and the difficulties in funding and so on. But what happened after question period that day was that the Minister and his staff, I'm not sure, I don't believe it was the Deputy Minister or Department of Health staff, I believe it was the Minister's, shall we call them political staff, that policy staff. Anyway, 2 staff members met with the MacDonald family. And during that time they were told that the Minister and his staff would look into things and that perhaps they could find a solution to the problem of funding for the drug. It's an antiviral drug. I'm to understand it's called Valsite, I believe. But since that time, and again, let me remind the Minister that that was in November 14th of last year, on November 14th of last year. But since that time, it's my understanding, and the same members of the family, the MacDonald family that raised it to the Minister that day, are in the gallery today. And it's my understanding that since that time, number one, there has not been a response, there has not been an answer given, and number two, that the MacDonald family is actually having problems having the Minister and or his staff even return their calls. So my question for the Minister off the start is number one, I'd like to know what has happened since the Minister's staff, at least that day, said there would be some answers provided. I'd like to know since that time what has taken place, where we stand with the issue, and what's going to happen, hopefully, when Mr. MacDonald receives his lung transplant, and he's on the list, and we all know that that unfortunately it takes time, and we know that it can be a lengthy period of time. But I'd like to know when that finally does happen, and we all hope and pray that it will be in the immediate future. I'd like to know when that does happen, exactly what is going to happen in terms of covering the drug and what has happened to date. And in particular, I'd like to know why the MacDonald family hasn't received any news from the minister and/or his staff.
Thank you. The Honourable, the Minister of Health.
Thank you very much, Mr. Chair, and to the member opposite. I welcome him to questioning over the next hour, and I thank him for bringing this issue forward, especially to Mr. MacDonald and of course to his family. I continue to wish them the best, and hopefully an organ donor will come along post haste and he'd be able to move on with his life. There, of course, is one drug, and I can't remember. I did start with V, and I can't quite remember the exact name of that. Valsite, I think, is what it was. I know there had been one meeting that I did have with the family after they had come to the house and after the member had brought them to the house. We had a full-length discussion on the drug requirements of their father. Of course, their father is in Toronto at this time. And I know there has been some correspondence back and forth. There was some further details, I think, that my staff had required, and I don't know where the communication breakdown is, but I know that there has been a meeting set up for next week, I believe, where the Deputy Minister will be sitting down with the family in order to come up with a resolution for the family. I would have hoped that, of course, this would have happened sooner, but unfortunately, we're here today discussing it again. So, Mr. Chair, to the member opposite, I can assure him that this will be discussed and fleshed out as quickly as possible over the next number of days before Mr. MacDonald will hopefully receive his transplant.
The Honourable Member for Glace Bay.
Thank you, Mr. Chair. Mr. Chair, well, I don't know, Mr. Minister, but I think that that meeting may have been arranged today, and I was wondering why it took a visit from a MacDonald family member again today to spur that meeting into taking place. It's been almost 6 months since the original issue was raised in question period in the legislature, and since the minister was made aware of it, and his staff did promise to look into it. And you know, most of all, it's quite perplexing to the family why the minister and his staff said this will be looked into, and when they make the phone calls, no phone calls are returned, and nothing is done about the problem. And so far, nothing has been done about the problem. The family has even gone as far, set up a website, as a matter of fact, and for those who are interested in contacting the family, and in particular Ed in Toronto, then the website address is www.tappy, that's TAPPY.ca. That's his nickname, Tappy. And they can contact the family there. But you'll see, and here's an interesting point, Mr. Minister, that I want you to be aware of. I'll save you the trouble of going on the blog, and I'll tell you that what's on there in particular. On the first page is some writings there by the family. One of the points that they make, other than the fact that they haven't been contacted again by the department and that they want to know what's going on, is that if they took the initiative to do some research, smart Cape Breton guys, okay, they do their research and they want to get their facts straight before they write anything. They probably get that from the fact that they've been connected with a journalist as a father for so long. But they did their research and they contacted the company that makes Valsite in Canada and asked about the sales for the first quarter of 2006. And it was just under $2 million. And then they went to Statistics Canada and got the population of Canada at 31.6 million, and Nova Scotia's population at about 913,000. And so once they did their figuring, they come up with, in their opinion, that a year's worth of Valsite for organ transplant and all other uses would work out to be, for Nova Scotia, in the vicinity of about $231,000. The actual additional cost to taxpayers would be lower, according to their calculations, because most of the valsite that is prescribed currently is covered by existing plans, such as the Seniors Pharmacare Plan, which, by the way, Ed McDonald doesn't qualify for, he's too young, and also the Community Services Plan and private plans. Now, ironically, and as they've pointed out here on their blog site as well, and I'll point it out to the Minister, I'm not asking for your comment, Mr. Minister, but I'll certainly point it out to you and your government. Ironically, if it costs $231,000 or less, as those figures indicate, to provide that drug to everyone in need of it in Nova Scotia, ironically, that government has no problem, your government, Mr. Minister, has no problem taking $232,000 and spending it on some fancy, glossy advertising to put out to taxpayers to show how great your government is doing. So I guess it's a matter of whether or not you want it to, what your priorities are, and if your priorities are, I guess, try and get the message across that you're doing a great job, or the priorities are, could you provide what we're terming as a catastrophic drug in Nova Scotia for every Nova Scotian that needed it, and cost less than what it actually costs to do that advertising on the government. I think it would make people perhaps think twice about where we're going and our line of thought in terms of catastrophic drug coverage. But just to, and I don't want to beleaguer this matter either, but you know, Mr. Minister, I think this could happen at any time. Mr. McDonald could be called to go for his operation, for his transplant. You know, I hope it happens tonight, right now. I'd like for him to get the call. But in case it does happen, that is going to be there as soon as it happens. They're going to need that antiviral drug, and the cost is going to be there. So I'd like to see some sort of resolution to this. I had thought that there would be a resolution to this by now because of the promise that was made there. And I was on the steps of the legislature the day that a member of your staff told the family that they would be getting back to them, and that they would be taking care of this matter, and that they would be looking into this matter. I was there when that was said, Mr. Speaker, so I would like a commitment from you right now, if you could, that indeed talks will take place with the McDonald family.
The Honourable, the Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, I will commit to the member opposite that the meeting will happen, post haste will happen, I'm hoping by next week. I'm not going to point fingers, of course, of probably who didn't call who or anything like that, but on behalf of my staff, I do apologize for the weight that this has taken. I would have hoped that there would have been a resolution to this one a lot sooner than now, but I will commit to having that meeting within the next week. The Deputy Minister, I know, has committed to that as well, so hopefully we'll have actually an answer by the time that meeting rolls around. You know, there are, again, a lot of drugs out there, pharmaceuticals out there that don't quite make the list sometimes, and sometimes they just have to do with not being aware of that drug or anything like that. So again, we'll commit to have that meeting early next week or within the week or so. And I know the family is here today, and I know that we'll have the opportunity to set that up in the next number of minutes. So, Mr. Chair, I want to thank the member opposite for bringing this issue to the floor.
The Honourable Member for Glace Bay.
Thank you, Mr. Chair. Hopefully we'll see a resolution to that problem that will please all parties, Mr. Chair. Let me move on. As I said, there's so many topics here that we could talk about. It would take much more time than we're actually going to allocate. But let's start, Mr. Minister. First of all, with what you call the Working Families Pharmacare, and at least, we'll give credit where credit is due. This program is now getting off the ground. But Mr. Minister, I think I'm being fair when I say that it's grossly underfunded. And left wondering if it's going to have any real impact. So if I'm going to give you a pat on the back for this one, it may be half a pat, Mr. Minister, because we haven't gotten into that full pat yet. But I'd like to know, in your opinion, what impact this program is going to really have on working families with only that $5 million worth of funding.
Honourable Minister of Health.
Thank you very much, Mr. Chair. And what we see in this year's budget is, of course, implementation costs of the Farmer Care Program, which of course includes the hiring of staff, because we don't have the staff to offer this program at this date. We don't have the information system that would be collecting, of course, the co-payments and premiums and the things that are required for this program that we have to develop. Whether that be developed in-house or whether that be developed with Medifee Blue Cross that does offer the service right now for our existing senior farmer care program. But what I can say to you, Mr. Chair, is that as we put the final pieces together of what this farmer care program is going to look like, we will be communicating that with Nova Scotians. We'll be communicating that, of course, with the member opposite. And it is my best wish to have this, or have Nova Scotians receiving benefits the end of February, 1st of March of 2008, because it does take the lead time, and I know we've had a number of times, a number of discussions around what the model is going to look like, how funding is going to be allocated, and those kinds of things. And looking at the sheer work that will be required, it will be taking that 10-month time is what we're sort of looking at this point. But Mr. Chair, I can commit that we'll be trying our best to for Nova Scotians to be receiving that funding by March.
The Honourable Member for Glace Bay.
Thank you, Mr. Chair. There are a number of topics, Mr. Minister, that I'd like to ask you about today. That was during this short hour, and among them, I'm glad that the government is finally listening to the recommendations of Cancer Care Nova Scotia regarding colorectal screening program. There is in this province a lack of gastroenterologists. So I'm wondering, Mr. Minister, who's going to perform the expected increase, I would take it, in the number of screenings that will have to take place? Where are you going to find the resources to do that?
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, if we look at what the design and what the recommendations are from Cancer Care Nova Scotia in a population-based screening program, we need to look at a bunch of different aspects. The first test, which would be administered, I believe, through your lab at a hospital, or being ordered by your family physician, your clinician, would be I think it's an fecal occult blood test. So that would, of course, go in for that first piece. The treatment piece would require the gastroenterologist and other cancer specialists, after that step has taken place. So what we really want to do over the next number of months as we put the pieces in place is look at their capacity of gastroenterologists in the province. Looking at where we, of course, need to maybe focus and do some recruitment to get these pieces in place, and making sure that maybe the gastroenterologist isn't exactly the person that we need. Of course, we need to have probably a few more lab techs and a few more specialists in order to get this program done. But, Mr. Chair, I can attest to the department's effectiveness in getting these professionals in this province.
The Honourable Member for Glace Bay.
Thank you, Mr. Chair. Among the recommendations that came from Cancer Care Nova Scotia, one was involved the tanning machines, Mr. Minister, and I'm wondering if, since you're listening and implementing some parts of the recommendations anyway that Cancer Care Nova Scotia has been talking about, if you're going to listen and implement restrictions around tanning machines, as they've also suggested.
The Minister of Health.
Thank you very much, Mr. Chair. And looking over at my colleague, the Minister of HPP, I know he has spoken to this issue on a number of occasions at this point. So I think that's a question there for HPP at this point on the restricting or regulations around tanning machines. I believe also the issue of restrictions around, I believe it's tattoos and those things. We're sort of in that same conversation, but Mr. Chair, that does fall under the purview of that minister.
The honourable member for Glace Bay.
I'm sorry, Mr. Minister, you said the Minister of Health Promotion? Okay, thank you. I'm also assuming then that in particular that would also fall under health promotion would be the cervical cancer immunization program. Would that also be there, and is that the case, let me ask you?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, to the member opposite, he's quite right in underlining that that is an issue for HPP, or health promotion and protection. Of course, it's a vaccine, and the immunization program fits under public health within that department.
The Honourable member for Glace Bay.
Thank you, Mr. Chair. On the issue of long-term care beds, Mr. Minister, the announcement is it's promising. There's no doubt about that. The implementation timeline, perhaps not so much. I don't know how people in this province are going to wait 10 years for those beds to be put in place. We have emergency rooms that are bursting at the seams in this province, Mr. Minister, as you well know, and people waiting for long-term care beds, and that does add even more pressure to the emergency room system that needs help all on its own. But specifically, Mr. Minister, if along the issue of long-term care beds, if keeping Nova Scotians in their communities is a priority, what about the 100-kilometer rule? And what about those couples who are being separated for long periods of time for long-term care placement? And another question, what about the use of transitional units as well? Perhaps the Minister could elaborate on those issues.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and maybe I'll work backwards from those questions and sort of start in with the transitional units. Transitional units, there are a number of those across the province right now, and we are looking at, as an interim strategy, is trying to expand on some of these and create a few more of them in other jurisdictions. We have earmarked about $10 million, I believe, towards this ALC issue or further point there. So we will continue to work with the district health authorities to try to alleviate some of the pressures that they're experiencing on a pretty regular basis now, as I discuss it with the various CEOs of those districts. You know, the 100-kilometer rule is one that is not because we want to have it in place. I think it's one out of necessity. We believe that Nova Scotians should be safe. They should be in a facility where they're going to be receiving services that they need. That they're going to be in a more homey, I guess is the best way to explain it, facility, rather than sitting in a hospital or a transitional unit, as they're called. You know, it would be my guess and my intention at the end of the construction phase of the first 832 beds that we would be able to make some changes to that placement policy and shorten that up, because ultimately, you know, the two things that we have learned quite often from our seniors as we've discussed it with them is that number one, they want to stay at home as long as possible. And number two, that if they are to go into a long-term care facility, that of course they want to go to somewhere that their loved ones can visit them on a regular basis. But at this point, the way the beds are set up and the way the system's set up, you know, it's very difficult to get that first placement that you want in your local area. But we also believe from a safety standpoint, it's very important to get them into a long-term care facility where they'll receive those services. If we talk about the 832 beds across the province and the 721 replacements, you know, there are things that are really chugging along, much to the chagrin of my department in most cases, where they feel they should have a little extra time in order to develop some of these things. But Mr. Chair, I think we are pushing it to the limit at this point to make sure that the RFP process is in place, which would be about phase one of this process will be in place in April. So the intentions, of course, have already been made of what those placements will be. We then can go through that RFP process where developers, whether they be the community groups as we know them today, whether they be private facilitators or private companies looking at those expansions. You know, if it's going to be the addition of numbers, you know, where you're adding 12 beds or 15 beds or even up to 20 beds, that process can actually happen quicker. The ones where we're going to be building, you know, freestanding facilities might take just a little bit longer. So what we're really trying to do is to get those numbers out, continue that work, and there's a lot of work that's ongoing at this point with the proponents to make sure that they're going to be ready for that RFP process, what they're going to be required of that, what the standards are, what we're going to be building, and those kinds of things. So there's been a tremendous amount of work done. But we're also looking at, I'm just looking at the deputy's handwriting here, is that the RFP process, as we understand it today, will be out on April 5th. So Nova Scotians and groups will know the work that they're going to do and will be able to submit. So I'm hoping that throughout this process that we can get a lot of these facilities on the road and get them running and have them, of course, within our first 3 years. The continuing care strategy also, and I did mention it again to a response to the Leader of the Opposition on the other programs that we're trying to bring in place for our continuing care strategy, which includes a further palliative care program, which includes home maintenance and home improvements, which I think that all of us agree is a very important program to keeping these seniors in their homes. You know, palliative care, home care in schools. There's a whole bunch of different programs that we're initiating as this being year 2 of our continuing care strategy, and we'll continue to implement these as funding, of course, is available. But of course, we will continue to get them in place as Nova Scotians and seniors in Nova Scotia so much deserve them.
The honourable member for Glace Bay.
Thank you, Mr. Chair. Mr. Minister, there was a case recently. You certainly wouldn't be aware of this, but there was a case recently in my riding. There was a couple that had been separated, unfortunately, because of the availability of beds. The husband was placed in the Tainamera long-term care facility. Yes, it was. The minister made reference to a Department of Veterans Affairs, right. It was. The wife in that case had been placed in a facility in New Waterford. Now, Glace Bay and New Waterford, as you're probably aware, it's only 13 kilometers apart. It may as well have been 113 kilometers apart for the family. But one of the things that was brought to my attention, and I'm sure you and your staff are aware of this, is that once the problem was solved, and the husband and wife are now together in the same long-term care facility. But one of the things that was solved was that the husband, who was separated from his wife, had been going downhill, so to speak, because of that separation. Once the wife had finally been moved into the same facility and the same room as her husband, and they were reunited, the husband's health actually improved to a point where there wasn't as much medication required, and so on and so forth. So I guess if you look at it and then extrapolate it, that you'd say that would actually be a cost saving to the Department of Health to actually go about doing that. But one has to wonder, Mr. Minister, how these things happen in the first place, and how they can be allowed to happen in this province. If we've reached the stage in terms of the number of long-term care beds that are available, would actually result in the separation of a husband and wife at that time in their lives, then we've reached the stage where perhaps our system, and in particular our long-term care strategy, is lacking the compassion that should be there as part of that strategy. And I think that should be, on an overall basis, that should be what, if not one of, then the #1 priority in that strategy. Mr. Minister, that's just a comment. You've explained the beds and so on, and we could go on at great length in terms of a time frame. If you were to put in place all of those beds tomorrow, Mr. Minister, you and I both know that would still not cover the need that currently exists in this province for long-term care beds. And waiting 10 years down the road is, as I said, is going to cause some great stress on the system, and in particular the people that are there waiting for those beds to be in place. Again, let me change subjects here, Mr. Chair, Mr. Minister. I'm wondering why your department is not keeping up to a promise regarding the stroke strategy, and why an additional $1 million, the promise for an additional $1 million in this year's budget is not there. Is that leaving that strategy currently underfunded?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair, and just as I get some notes down here and make sure I try to flow my answers correctly. Just going back quickly on the placement of spouses. About 15% of our seniors in this category have a spouse. All right, and probably a lesser number of that would require placement at the same time. So it is a difficult situation from a system that is really rough on, not rough, difficult to react to certain circumstances. It is our policy now within the department to place loved ones together. And I think the case that the member opposite talks about, that a placement was offered to them. If you look at the original piece, which is that I think the gentleman is a World War veteran and was in DVA placement. DVA placement will not accept their spouses, unfortunately, because I think they have some capacity. But what we did is, after we had heard of the situation, we had offered a placement in another facility, and I think the member opposite mentioned a placement in Glace in New Waterford, which is of course about 13 clicks away from Glace Bay, and of course the family said no to that idea. I know at this point that they're still working with that family, and I think the placement has happened in a facility a little closer to home. So, you know, as much as we have to try to stick to policy in order to not impact other people within the system, you know, I know we need to have to be fluid to make sure that people are in the correct facilities and are receiving the services that they so much deserve. Also, if we talk about the placement of beds, and if we talk about the first 832, is that we're placing those 832 to bring us up to a standard level across the province within 3 years. Our idea at this point and our initiative at this point is to place 200 more every year thereafter. So we will continue the placement of beds so that when you do get to that 10-year piece, all beds will be in place at about a rate of 200 or so per year. Going to the stroke strategy, we will continue to work with that stroke strategy. There's $500,000, I believe, in this year's budget to continue funding the stroke strategy for District 2. And we will meet that timeline for that stroke strategy. The stroke strategy had a timeline from 2007 to 2011. If you look at, I'm just trying to read through. If it looks like, the concurrent provincially led work includes, at this point, development of draft stroke acute care guidelines, an environmental scan for stroke rehabilitation, development of post-acute stroke rehabilitation and community reintegration guidelines, a provincial stroke audit, and a provincial professional education needs assessment. And Mr. Chair, I can say that we are still moving forward with our stroke strategy to have it in place by the timeline of 2011.
The Honourable Member for Glace Bay.
Thank you, Mr. Chair. Mr. Minister, I thought it was my understanding anyway that there was $1 million promised in this year's budget for that stroke strategy. There was supposed to be $1 million promised in this year's budget, but it's not there. It's only $500,000. So, you know, what happened to the other $500,000?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And I think a part of the exercise this year as we develop budget as we looked at the funding of programs, that we had to look at what our objectives were, what the timelines were, and what we could fund. And I'm really happy that we were able to fund this continue to fund this program for $500,000. And Mr. Chair, at this rate, we will continue to fund that program until it's complete in 2011. So, Mr. Chair, I think it's about trying to find all the priorities, making sure that they're funded adequately, and making sure that we have enough funding for the other programs that are within the Department of Health.
The honourable member for Glace Bay.
Thank you, Mr. Chair. And I do, Mr. Chair, understand the severe restrictions and pressure that the minister and his department are under when it comes to, in terms of funding. In terms of diagnostic equipment, Mr. Minister, the province needs additional, I don't know the exact technical word, but I think they're called the phrase bone densitometers. Am I close? Anyway, they need additional units to just keep up with the national standard, what the national standard has become. And I'm wondering, and the minister and his department have been made aware of this for quite some time, will the department fund the 7 units that have been requested and that are urgently needed across this province?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And just quickly to finish off the stroke strategy piece, and I'm just reading here. The multi-year funding will support 2 years of planning and education, followed by ongoing incremental district-led implementation of components of that stroke strategy based on priorities and needs. So we did feel that the $500,000 was adequate to meet those objectives. In regards to the bone densitometers, I know we had the opportunity on a couple of occasions now to meet with the Osteoarthritis Society of Nova Scotia and the interest in expanding our scanning program. And I can say, Mr. Chair, that this year's budget includes the addition of 2 bone densitometers here in Capital Health, where of course our wait list is far too long. I believe that I think an average wait, or the length of the wait, is somewhere near 400 days, which of course is well over anybody's expectations, especially for a type of diagnostic which, of course, if it can identify the onslaught of osteoarthritis, with a course of drugs, can change the outcome of these individuals, a very positive outcome for these individuals. And in the backside, we do not end up seeing them in any emergencies with broken wrists, broken shoulders, broken hips. So we have worked with the group, but we also said is that we cannot fund all 7 machines at this point, but we do feel that trying to address our largest wait list and our largest area by the addition of 2 machines will greatly change the way that this service is being offered at this point.
The honourable member for Glace Bay.
Thank you, Mr. Chair. Mr. Minister, I think in terms of the issues surrounding diagnostic equipment and the issue of human resources that are available to operate that diagnostic equipment, then there are areas, there are some district health authorities, for instance, that don't have MRIs in this province. But in terms of I guess it connects with another issue, and that is the lack of technologists to operate some of that diagnostic equipment. And you do have some places, Cape Breton is one of them, I know, where new equipment is sitting idle because of a lack of qualified technicians or technologists. So the obvious question would be, what's being done by yourself and your department to try and bring some light or solve some of the problems associated with the lack of human resources in that area?
The Honourable the Minister of Health.
Thank you, Mr. Chair, and thanks the member opposite for also underlining this very important issue in healthcare. You know, as I alluded to a couple of times in my speech, and of course in my answers to the leader of the opposition, you know, 3/4 of our budget goes towards funding the salaries of our much needed healthcare workers, and that includes everybody from doctors to technicians or you know, in this case, when we talk about the usage of bone densitometers, of course, would be a radio tech or one of those individuals. What we're trying to do within the province is that we haven't had a provincial HR strategy insofar as most of these human health resource positions. And what we have done through the implementation of an HR person within the department is that we're starting to work on the paramedical HR strategy, which will work with the different organizations, the different colleges, and those individuals on the attraction, the training, the retention of many of these much needed professionals. The issue also is no different than most of our professions if we compare it to physicians and those types of folks, is that on a Canadian context that we do have issues in training right across the country. We are in competition with many other jurisdictions, and we need to I believe, is have more seats available here in Nova Scotia, so we are training more of our Nova Scotians and making sure that they do have competitive remuneration at the end of those courses. So, Mr. Chair, I know that again, I'm talking a lot about strategy and looking forward and putting these pieces in place, but I know that if we don't get started on some of these things, that we will not be able to staff a lot of the equipment that we are adding to the province and a lot of the programs that we're talking about implementing as well. So a lot of these things have to go hand in hand, whether it be setting up programs, but it also has to go in the retention and attraction of many of these professionals.
The honourable member for Glace Bay.
Thank you, Mr. Chair. Mr. Minister, they do, you're correct, of course, they do go hand in hand. And you know, as you look at providing human resources or staff for the services that are required, then I would imagine it brings me to my next subject, and that is the subject of funding for district health authorities. There is only a 5.3% increase to DHAs, and or at least they were getting used to 8% increases over the last several years. So with that cut in funding to DHAs, Mr. Minister, I'm wondering where you're expecting the district health authorities to cut back.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, if we look at the funding to district health authorities, you will see that they once again received their 7% non-wage increases. They also receive the funding towards added increases as a result of wage settlements. They will also be receiving the normal increases that they need through their business planning process. So, Mr. Chair, I'm not expecting district health authorities necessarily to cut, but what I am expecting of district health authorities is working to the number that they will be receiving from this department.
The honourable member for Glace Bay.
Thank you, Mr. Chair. Mr. Minister, that number is probably going to be less than it has been in the past. I'm taking a guess at it anyway, because there have been, you've made promises concerning an increase to salaries and topping up pension plans and so on and so forth. But again, you know, the question would have to be asked whether or not where are you going to trim? You know, the district health authorities can only go so far with so much, and yet the other funding may be there. But where eventually, when you tell a district health authority you're not getting as much as you did last time, then where are district health authorities going to trim?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, I think this year's budget and what we're mandating, what we're asking for, is really to work to the numbers that we're going to be providing to them. We're talking about limiting the new programs that tend to crop up year over year. We're looking at a status quo budget in this case. and we want we want to continue to work with the district health authorities to find ways to continue to work together and really find some true cost savings in really sharing expertise and working together.
The honourable member for Glace Bay.
Thank you, Mr. Chair. Let me move on to some issues regarding legislation, Mr. Minister. In particular, the Midwifery Act was passed this fall. But am I correct in saying that yet there are no regulations and that bill has not been proclaimed? And if that's the case, when will we see this?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. Mr. Chair, I can say there's been a fair amount of work done at this point in regards to midwifery and the regulations that are required as a part of the college and a part of the Act. The multidisciplinary committee is up and running. They are working on those reglements. I'm thinking in French again. But ultimately, we feel that these will be prepared and ready to go in November. And at that time, as both of them are available, the regulations of the Act will be proclaimed subsequently.
The Honourable Member for Glace Bay.
Thank you, Mr. Chair. Well, I said there were a number of issues regarding legislation. The Midwifery Act was one. There was a new Registered Nurses and Licensed Practical Nurses Act, which was passed in the fall. That also has not been proclaimed. The Massage Therapists Act was passed in 2003 and not yet proclaimed. And the Dispensing Opticians Act was passed in 2005 and not yet proclaimed. So, Mr. Minister, would you agree that the time to fulfill the will of the legislature and the needs of those groups has come?
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And Mr. Chair, when it comes to a fair amount of these, the acts that the member opposite brings forward have to do with work that we're doing with the respective colleges and the regulations that they have to bring forward. I would have to offer further information on that one at a later date to figure out exactly what's standing in the way of proclaiming these Act. I know the registered nurses and the licensed practical nurses, those two acts are still awaiting some information from their respective colleges, as well as the Dispensing Opticians Act. The Massage Therapists Act, I'm not too sure of where that one is, and I don't think we've accepted that act. I don't know where that process is, so I will get further information. I will get further information for the member opposite on this one.
The Honourable Member for Glace Bay.
Well, Mr. Chair, I was just perhaps soliciting the minister's opinion on this one, because I'm sure the minister would agree that those are important pieces of legislation, which in some cases he has brought forward, and on the floor of the legislature they've been debated, they've been discussed, thoroughly, and the legislature decided for those pieces of legislation to be sitting around for years on end really doesn't fulfill any of the requirements that, again, he and his government have put forward in terms of taking care of those issues, which have been nagging issues for quite some time, Mr. Chair. They've been around for quite some time. It's nothing new. Let me ask the minister again, just switching. I know we don't have much time left, but for this portion anyway. But let me ask the minister his opinion on portable defibrillators. I think we can both agree that they save lives. As a matter of fact, I read a resolution during the session today which dealt with a gentlemen's hockey league in Glace Bay, which went about raising the money, some $5,000, to purchase their own portable defibrillator, because we haven't reached the stage in this province yet where we do that. They have in other provinces. There was a story that was in last week's Chronicle Herald that outlined a portable defibrillator actually saved the life of an elderly woman. And the same story has been heard at hockey rinks and arenas and community centers throughout the province, where in some cases the defibrillators are now available. And indeed, Newfoundland is starting an awareness program. Newfoundland and Labrador is starting an awareness program in their schools on actually how to use the defibrillators. And the Liberal caucus introduced a bill in the fall that talked about access to portable defibrillators for everyone. So I'm asking the minister now, where are you with that subject, Mr. Minister? And if you wanted to announce right now, it would be great if you announced that the Liberal bill is going to be brought forward.
The Honourable Minister of Health.
Thank you very much, Mr. Chair, and I'll start off by finishing maybe the last thought when it comes to the proclamation of bills that have passed the floor of this House, and you know, I don't think it's because we don't want these bills to pass. I think there's further regulation pieces that have to be complete before they're proclaimed. And again, I will commit to provide information to the member opposite, except for the Massage Therapist Act. And I believe, it's talking to the deputy here about this one, is that I don't think that act actually passed third reading. So I have to find some information on that one. Be sure. I know we've been in talks with to bring a new bill forward, but it's still sort of in discussion at this point. When it comes to portable defibs, I believe that's also under the purview of the Minister of HPP as I look over to him. You know, the data that we have at this point is that you know, only 2% of heart attacks occur in public buildings. So we have to really balance the priority and the funding available. But I think the member, the Minister of HPP is looking at that, and I think he actually talked about, the member has talked about, or the Minister of HPP has talked about putting defibs in our recreational facilities. I think he announced that a month ago, I think is what he's talked about. So again, that'd be a question for that member when his time comes on the floor of this legislature.
The Honourable Member for Glace Bay.
Thank you, Mr. Chair. So if the minister is saying that you know, putting it in another department and health promotion, then if the minister is saying that the likelihood of public defibrillators is going to occur in Nova Scotia, that's great news. But I'm not sure that's what the minister said. But if indeed they're looking at the possibility of funding defibrillators in public buildings in Nova Scotia, then that certainly would be welcome news. But I'm not sure if that's exactly what's being said. The bottom line on defibrillators being provided anywhere, Mr. Chair and Mr. Minister, is that they save lives, and it's a proven fact now. It's a relatively inexpensive piece of equipment now, which through time has progressed to the fact that pretty well anybody can use it, and there is no danger associated whatsoever with the devices where they stand right now, and I'm sure technology continues to improve on a daily basis. I wanted to, and I know we're running out of time, and I didn't want to just take one last question, Mr. Chair, and throw it at the minister, because it's a question that is going to take a lot more time than what he has available to answer it in. But I will throw him this one at the end of my time here today, and that is regarding the issue of wait times. It's an issue that the government promised less than a year ago during their last election campaign to concentrate on reducing wait times for medical services, but I can't see where any money has been earmarked for that, not that I can see, for that kind of a program. So I'm wondering, what is the government's plan to fulfill that promise?
The Honourable Minister of Health.
Thank you very much, Mr. Chair. And you know, the wait time issue is one that is really all-encompassing in everything that we do at the Department of Health. If we look at every piece of investment or every bit of work that we do, somehow impacts a wait time. If you look at the announcement we had on Wednesday, I think of last week, where we talked about the expansion of satellite services for cancer, you know, spending some more money at those satellite sites in Yarmouth and Antigonish and Inverness. The adding of a satellite site in Kentville goes towards two things, which is providing Nova Scotians with service closer to home, as well as improving the wait times in those aspects. Today, I was very happy to make to make an announcement with my colleague, the Federal Minister of Health, of the investment of $48 million towards improving wait times in radiation oncology or radiation therapy, which would see the purchase of some new equipment, of linear accelerators at Capital Health here, as well as Cape Breton District Health Authority, which would mean, you know, the increase of staffing at some of those at those two sites, which, you know, at this point we felt that was a good place to really start focusing on, as we have so much prevalence of cancer in this province. You know, it's a frightening statistic when we think that about 23 people will be diagnosed with cancer today, will be diagnosed with cancer tomorrow. So, you know, we're looking at about 28,000 people are living with cancer today, and that number will continue to increase. So we need to continue not only to address wait times today, but to make sure that we have the facilities and infrastructure in place to meet those wait times tomorrow. We've also found that we can't do it alone. We need to have the input, of course, of other levels of government. We need to have funding from the federal government. I was very happy that they came with that $48 million to help us with this wait time. It also addresses a couple of pilot projects when it comes to orthopedic wait times. It also looks at the wait time for diagnostic imaging. So we look forward to working on those two projects, or those three projects immediately, to help access or improve access for all Nova Scotians. We also talked today about the wait time strategy. We had the wait time committee developing some number of recommendations for us, and the number one recommendation was, of course, we need a provincial strategy to address wait times. And we have done that. That wait time strategy is now available on the website. And I would think that everything we do in the department, every piece, every bit of investment that we put into the department, into our healthcare system, will improve wait times.
The honourable member for Glace Bay.
Thank you, Mr. Chair, and I appreciate your answer, Mr. Minister, and I know the complexity of the problem, but the problem most of all seems to be that the government has been given money to and has spent money to monitor wait times. It doesn't solve the problem. Monitoring wait problems and wait times and study after study, and then, you know, the whole exercise of collecting data, and then you do it all over again, and then you collect more data, and people are still waiting far too long for healthcare services in the province, Mr. Minister. When you have in this province, Mr. Chair, when you have orthopedic surgeons, who become so frustrated that they actually tell their patients, well, you know, if you want it to fall down the stairs and go to the emergency department, then they can operate you for your bad hip, and you'll get treated quicker, because if you go into the system and get into that system and be tied up in wait times for orthopedic surgeries, who knows how long you're going to be there. So, you know, that's the problem that we're faced, Mr. Minister, as you well know, and the Auditor General, who did a study of wait times in the province and made a series of recommendations to improve the monitoring of wait times, which is great. You know, those things are needed, those things are required, but to actually reduce the overall length of wait times, I think, would be a priority and a goal of your department. And I'm wondering just how many of those recommendations, for instance, Mr. Minister, and I know that it's hard to hear sometimes in the chamber, but just an indication, Mr. Minister, of how many of those recommendations, for instance, from the Auditor General, are actually being followed.
The Honourable the Minister of Health.
Thank you very much, Mr. Chair. And again, this issue we could talk about for a number of hours. And really what we're going to do is talk about it for about a minute. And you know, quickly, a lot of those recommendations are held within the provincial strategy to address wait times. Again, to have that provincial strategy, I think, is very important. I invite the members opposite to download that piece of information, to look at what those recommendations are, and it will impact our business planning process and making sure that we address wait times at every instance. So, Mr. Chair, I think it's very important that we continue to invest in equipment and human resources, and only at that time when we have central listings and those kinds of things that we will be really truly be able to address wait times in this province. But I know we are making a fair amount of headway at this point. So thank you very much, Mr. Chair.
Order. The time for the member from Glace Bay has expired. We'll take a short recess for about 5 minutes for the minister and his staff.
Order, please. I will now call the Committee on Supply back to order. The Chair will now recognize the honourable member for Sackville-Cobequid.
Thank you, Mr. Chair, and it's definitely a privilege to stand again in this chamber to discuss the health estimates. This is in preparation for this. I think this is the third one in less than a year. So definitely it's an important issue that I think many Nova Scotians look upon government to ensure they make the right choices and that the health of Nova Scotians is taken into account. It was interesting in my preparation for this, looking through the response from government from this budget. And it was interesting to read some of the clippings from the newspaper around what last Friday's budget was all about and what Nova Scotians could expect from it, Mr. Chairman. And I'll just read a few of those, and I'll refer to them throughout this hour and I think earlier tomorrow. And one of the first ones I came across was in the Daily News, and the title was Dreams Deferred Till Another Budget Year. And it also stated about broken promises and talked about the mental health tax credit, which was one of the issues that the Conservative government brought up during the past election. Also was around to create a pharmacare program for low-income families by 2008. That also we know because of the budget and the budget on Friday that won't take place, where it won't be fully implemented, Mr. Speaker, or Mr. Chairman, fully funded this year with this budget. And also in there is some of the reactions of those healthcare providers, those professionals who work in the system and work in healthcare here in the province. And I'll quote from one of them, and that's Dr. Rhonda Church, who is the president of Doctors Nova Scotia, Mr. Chairman. And she said about 30% of her Bridgewater patients can't afford the medication she prescribes. One patient, she said, pays $200 to $300 a month out of her own pocket for cardiac medication. It's disappointing that the program isn't coming in sooner, Church said. There are $200 to $300 a month over a course of a year is a huge hit for these people, and we really need to see government commit to helping them. That was on the 24th, I believe, Mr. Chairman. Another headline also in the Chronicle Herald, Mr. Speaker, was the colon cancer screening on hold. And I'd like to just read the first paragraph, Mr. Chairman, because I think it really brings home the need and the importance of a colorectal screening program here in this province. Hundreds of Nova Scotians will be diagnosed with colorectal cancer this year, and hundreds will die. But a program to screen for the disease while it can still be cured remains a year away, Mr. Chairman. And also, it was one of the commentaries from David Rodenizer in the Daily News, and he was quoting the finance minister, I believe, just after the budget proceedings on Friday, and he talked around, the finance minister said, the increase in healthcare spending, that is, Mr. Chairman, will be held at 5.3% this year, although his budget numbers indicate a growth of 6.6%. And also going through that, Mr. Chairman, was the quote from the Premier in the Daily News on March 24th, and he states here, we have to make choices, end quote, Mr. Speaker. And I think that definitely brings together some of the areas I'm going to try to get some clarification on and make definitely bring awareness around the choices that this government makes, Mr. Chairman, the choices that they made in this budget, the choices that they made back prior to the last election, Mr. Chairman. They definitely made those choices, and that is what the people of the province have to live with. And, you know, it's especially around health care, Mr. Chairman, you know, it doesn't, you don't have to look far or look at the data around election polling or the opinion of Nova Scotians, and that, for that matter, Mr. Chairman, opinion of Canadians about health care and how important it is to them, Mr. Chairman. So what I'll do is go through a whole list of different areas, I think, in healthcare that we will try to get some answers in. One, which I know that the Minister of Health will will maybe challenge me on is around the privatization of healthcare, Mr. Chairman, and some of the comments made by the Minister of Health, made by his government, and hopefully get some more information around what exactly the Minister of Health and his department and his government want to see in the future when it comes to healthcare delivery here in the province of Nova Scotia. The other area I'm going to cover is a little bit around, I know the leader of the official opposition touched upon drug coverage and the cost of medication in the province, like the drug Avastin, Mr. Chairman, but to further on that or piggyback on that is the need for the catastrophic drug plan that I think not only our province needs but our federal government needs. So I'll try to get some questions, some clarity on that issue, Mr. Speaker. Of course, around the pharmacare program for the seniors and the what we'll call the family working pharmacare, or whatever the new terminology the government wants to put on that. There's so many issues, Mr. Chairman, in health that we'll have to try to cover. Of course, one of the biggest ones is the emergency rooms and some of the closures and wait times that we see within our emergency rooms, not only here in the central regions of our province, like HRM or Cape Breton Regional Municipality, but especially in some of our rural areas, Mr. Chairman, and the crisis we see in the waits there, the ability to ensure that there's proper coverage there when it comes to specialists, when it comes to emergency room physicians, Mr. Speaker. And also, some of the questionings I'll be asking the Minister and his staff over the next couple of days will be around long-term care, Mr. Speaker, or Mr. Chairman, and I think I'll eventually get that after the next little while. But first of all, I just want to mention, I know the member from Glace Bay mentioned it, that we want to thank the staff from the Department of Health for going through this process. The Deputy Minister, I know it's definitely a hard event to do and try to get all the work done in time, but I want to especially thank the healthcare providers in this province, because I think we do have some of the best healthcare providers in this province, Mr. Speaker, who work extremely hard to deliver healthcare to Nova Scotians. So I'd like to start some of my questioning this evening with the Minister around the privatization, or what I'll call the privatization of healthcare in this province. We know the Minister of Health has stated in the past about a private flair to healthcare delivery in this province, and around that everything is on the table when it comes to healthcare. And I know that we have limited time. That's why I enjoy the fact that we can come here in health estimates to get the attention of the Minister, his deputy, and his other staff, and hopefully gain some insight on exactly what the Minister of Health, his department, or his government has planned for Nova Scotia and for the delivery of healthcare. So my very first question to the Minister is, when you stated that everything is on the table, Mr. Minister, could you maybe advise Nova Scotians, have you seen anything, has anything come across your table that pertains to privatization of healthcare here in the province?
Thank you. The Honourable Minister of Health.
Thank you very much, Mr. Chair, and I thank the member opposite, the member for Sackville-Cobequid, I believe, for his question and his lead-in. I know he's going to cover a lot of ground over the next hour, and I look forward to the subsequent hours of questioning from him over the next number of days in regards to the estimates of the Department of Health. We start off with an issue that I think is an extremely important one to Nova Scotians, because as it stands in this day, and what we continue to try to do is put the patient first. We want Nova Scotians to be, of course, the most important part of our healthcare system. We want to make sure that they receive the services that they require to make them healthier, to let them get through whatever ails them, to get through that system. Now, back in the fall, we introduced a bill, Bill 126, which is the Health Facilities Licensing and Equitable Access to Insured Services Act, and that act looks at licensing private facilities. As it stands today, there is no such licensing act. any provider that would be interested in setting up shop in Nova Scotia could do so without government intervention. What we were trying to do with this act, what we'll continue to try to do over the next number of months is look at its function when it comes to ensuring patient safety, to ensuring no queue jumping, to ensure that things are done in one system, so the patient would not know the difference between any one different system. So that when they, for example, need MRI, I don't think a patient would mind getting that MRI from one facility to another facility, as long as they know that other people are not getting that test quicker if they have the money to pay. So what we're trying to do is create one queue, one wait list per se, and making sure that Nova Scotians or taxpayers in Nova Scotia are paid for the one system. So there is none of this rhetoric about two systems happening in the province. But what we're doing is that we definitely put our ideas on paper. We introduced them in this House of Assembly for debate. But in the meantime, until we get to debate them on the floor of this House, we felt it was very prudent and very important to have some extensive consultations on it. And I can tell you up to now we've had a number of consultations, whether it be with the respective colleges, with unions, with physicians, with specialists, to see what their thoughts are on private opportunities within our healthcare system. And I can say that some of the meetings have been positive, and some meetings have been less than positive. And we'll take that information. We've provided notes of those meetings back to our information of those meetings back to the respective groups that we've met with, so that they get a good feeling of what was discussed and what was not discussed. And we'll take that information back when the second reading comes to the table or comes to the floor of this legislature. But Mr. Speaker, I can also say that no huge lineups have happened, which is what I suspected in the first place, of private companies wanting to set up here in Nova Scotia. We have to find a balance of the opportunities for certain physicians and certain specialists to be entrepreneurial. At the same time, we have to be conscious that there is no negative impact on the public system as it stands today. So Mr. Speaker, I know the member opposite thinks very passionately about this issue, but Mr. Speaker, I know that Mr. Chair, I will continue to put the patient first to make sure that they have a system that will respond to their needs, and I look forward to further discussion on Bill 126 as it comes to the floor of this House at a future date.
Thank you. The honourable member for Sackville-Cobequid.
Thank you, Mr. Chairman. And I think that's where we'll find a difference, definitely in what our opinions within our caucus and our party, and I think the difference in the opinions and the thoughts of the Conservative caucus and their party when it comes to delivery of health care in this province. The reason I'm so passionate about this is because here we have the Minister of Health who just said that he's not in favor of queue jumping, as I believe what he was trying to get at, or what he was saying. But what I don't understand is if we're going to allow these private clinics to open up here in our province, if we're going to allow individuals to go to these private clinics, why would we invest taxpayers' money in these private clinics if there's not going to be any benefit, or maybe the minister can tell me the benefits from having private clinics throughout our province, which we're already seeing, because I think government made the choice many years ago, I know since I've been elected, that they wouldn't address the issue of these private clinics coming to this province. And I know we've had debates, and my caucus has debates, and our party has had debates on private clinics like the MRI clinic that came to Halifax several years ago now. But why would we take taxpayers' money and invest it in the private sector? If we're going to pay for that service, why don't we pay for that service under the public system? Why don't we take that money, ensure that the money goes to ensuring the public system is supported, is secured, and that we don't see an erosion of the public system, especially our human resource aspect of it, Mr. Chairman. The minister knows that we have an issue here in the province with retention and recruitment of healthcare professionals, and I know that private clinics come with all the bells and whistles, and one of the things they do come with is a bag full of money to entice those healthcare workers to come to those clinics. I've read the studies down through the states, Mr. Chairman, and maybe the minister has read other ones that contradict this. Maybe he can elaborate on that, but I know that they erode the human resource aspect of the public system if we were to allow this. So from what I'm hearing from the minister, I would suggest that maybe the Bill 126 that he introduced, I believe, in November of last year, should have been something this province seen many years ago. Would the minister agree that we're trying to play catch-up when it comes to private clinics and the opening of private clinics here in our province?
Thank you. The Honourable, the Minister of Health.
Thank you very much, Mr. Chair. And this is a very important issue, and one that I'm very happy to discuss. Mr. Chair, for years, subsequent governments have been scared to bring scared to bring this issue forward. And I think what we need to do is try to get a real debate going on what private healthcare system or private healthcare delivery is and what it isn't. And I think that the value of introducing this bill puts every bit of ideas that we've talked about in the department for a number of years, and we're asking groups, organizations, colleges to come back and provide us with their thoughts and see how we can either incorporate them or not. But Mr. Chair, I think what it really stands to